Everyone, so I am demonstrating the method of knot tying. So you will need these instruments. This is a knot pusher. It is used to push the knot, and there is a small socket for eye for insertion of thread. So it is used to push the knot. I have made a replica of it which is similar to it but for a bigger thread or rope for practice. I have learned from many teachers and they all have advised me to learn only one sliding and one stationary knot to avoid any confusion. So only one knot and master it. That is the best way. So I suppose that you have these instruments suture lasso, a scorpion and suture retriever that are used inside the scope. So now I will demonstrate the method of knot tying. So knot are of two types, one is static knot and one is stationary knot. So you have to learn both sliding and stationary knots. Sliding knot can only be performed when the thread is suture sliding freely over anchor or some post. If it is not sliding, then only stationary knot will work. So I will demonstrate both. This is the sliding knot. The left one is used as post, which is where the knot slides. So the post is kept roughly half of the other limb. Other limb is loop or non-post. So now keep your index finger in between both and then use 3 loops. One, two, then over it, then third, and then bring that thread back in between index and first loop. So after you insert it, you withdraw your index finger and tighten the knot. Pull non post a little and you can also back tighten it, then insert the knot pusher or you can insert it beforehand. So while pushing you have to take care that you leave your non-post free and only slide the knot over the post. So this way post will become longer and we can insert the sliding knot. Sliding knot can back out, so it has to be backed up with a stationary knot. So now over sliding knot we have to back it up with stationary knots. So for backing it with a static knot, please note that now this knot is not sliding over the thread. So if inside shoulder you have some situation where the thread is not sliding freely, then you don't have to do sliding knot. So this sliding knot cannot be backed up with a sliding knot, it has to be backed up with a stationary knot. So for stationary knot you have to do half hitches. Half hitches is just like surgical knot. So if you are doing surgical knot by hand, it is very easy. For half hitches you keep your hand like this and with palm facing upwards with another 3 fingers. Now with the use of middle finger, pull the other thread inside the loop, and this is a half hitch. It is very simple. You all have threads that are with you, so practice it right here right now and today in your room also, and then you will master it. And then you have to push the knot, and while pushing you have to slightly tighten the non post also for half hitches. And after you have gone to the sliding knot, then you have to past point it or go beyond the knot like this. So this helps in securing the stationary knot. Now it has to be backed up with more like this. The same process is repeated. Middle finger uses to bring the other thread in and further tighten it. So we will do one more, and then it has to be locked. So when it is locked, then only it will get secure. So for locking we have done just reverse. We have used the left side finger. I hope you have noted. So this completes the knots.